Today we have Padma Bhushan Awardee Dr. T.S. Kler, Executive Director Fortis Hospital with us to share his valuable thoughts on heart disease. Sir, please suggest some healthy tips to lead a healthy and happy lifestyle.
Well, basically, if you want to prevent heart disease, which is I think very important issue, because the treatment of heart disease is very expensive. Number one, number two, heart is some a organ where if you don't treat it, the people can die and they can die very early. Uh, See, basically, we need to take care of our health by first of all, zero smoking in any form. Number two, if somebody has a blood pressure, it must be treated very adequately, and the target of blood pressure should be below 140/90. That is the aim we want to keep. If you have diabetes, diabetes should be treated very effectively. And when we say effective treatment of diabetes, that means there is a test called hemoglobin A1C. Now this test should be done every 3 months, and this tells what has been the control of diabetes in last 3 months, and we want this figure between 6 and 7. So that's number three. Number four, everybody should have his cholesterol lipid profile done, and particularly we need to see the bad cholesterol, which is called LDL. Now we do recommend that in normal persons who don't have heart disease, their LDL should be kept below 100 milligrams, but people who have already heart disease, some kind of blockages, there the LDL should be kept below 70. Then some regular exercise, 45 minutes a day, at least 5 days a week is very good to prevent heart disease. And I would say lastly, not the least, is very important is how to de-stress yourself, because stress is increasing in our society, and stress really damages not only heart but every part of the body. So all of us need to understand and develop our own ways how to de-stress ourselves. Whatever suits your mind, you should do, either going to temple, gurdwara, or doing sitting with friends. Whatever way you can relax your mind, it's a good idea. And I can tell you one thing, that there is a lot of positive role of yoga. If people will start doing yoga, it is de-stressing. It is also physical exercise, and the proper yoga can go a long way to prevent heart disease.
Sir, let our viewers know about the complications that may be associated with angioplasty or this stenting procedure.
Well, there are many complications which can occur. First of all, you need to understand that no procedure in medical field is totally safe. Every procedure, even maybe a minor operation like appendicectomy or tonsillectomy, people can die, complications can occur. Well, basically, the complication, the major or the dreadful complication that a patient can die during angioplasty these days are very little, less than 1%. But minor complication in the form of some blood loss, hematoma formation, and some allergic reactions can occur in many patients, which can be addressed without much of a concern. One of the complications which can occur after stenting is that some people can develop re-blockage in the stented area wherever we put a stent. Now it used to be very high incidence before, but now with the development of new generation stents, particularly the drug-eluting stents, the chances of recurrence in good quality stents is between 5 and 8% these days.
Thank you for your valuable time, sir.